Hello everyone, myself Barsha Roy and I am currently pursuing my Bachelor's of ELECTROTHERAPY degree from Marwadi University, Rajkot. So in this video, we are going to talk about the principles of Russian current. So let's start. So let's start with the introduction. Russian current, it is a medium frequency alternating current which has a frequency of 2400 Hz to 2500 Hz, which is delivered in a burst mode. And this current was discovered by Russian scientist Dr. Yobov Kors in 1977. So this current is also known as Kors current, and it is used to generate a strong and painless muscle contraction in athletes to strengthen their muscles and in the rehabilitation purpose. So the principles of Russian current. The principles and parameters of Russian currents are defined by very specific waveforms and treatment protocol. So, in the waveform principles of Russian current, first is the carrier frequency. The carrier frequency of the Russian current is 2500 Hz, which is sinusoidal alternating current, and the burst frequency. The current is interrupted in 50 Hz. So, that means there is 50 bursts per second, and the duty cycle. Duty cycle means there is 50% of duty cycle in the Russian current. So, current will flow for 10 milliseconds, and there will be rest period for 10 milliseconds, and within each burst. And the training protocol, there we will follow the 10-50-10 training protocol, in which 10 seconds there will be contraction, 50-second rest, and 10 repetition to complete 10 minutes. So next, indication of Russian current. First one is muscle strengthening. The main indication of Russian current is to strengthen a muscle. So second one, prevention of muscle atrophy. After prolonged immobilization and disuse, the muscle undergoes atrophy. So to prevent that, we use this Russian current. The third one is improvement of athletic performance. It will help to improve the athletic muscles, like it will help to strengthen the muscles of the athlete. The next one is enhancements of the circulation to copy or to to increase the blood circulation by natural muscle pumping action, and the post-operative rehabilitation, like after ACL reconstruction, we use this Russian current. So next is contraindications of Russian current. Contraindication means in such situation we should not use this current. So first one is pacemakers or implanted electronic devices. If any person is having pacemaker, we should avoid the Russian current because it can interfere with the current flow of the pacemaker. Second one, pregnancy, especially in the abdominal back area, because it can induce the false uterine contraction. Then third one is malignancy or cancer. It should not be used in a patient with malignancy because it can increase the blood flow, and it can spread the cancer to other part of the body. Thrombosis, it should not be given because if we give current to the patient, that natural muscle pumping action will be there, which can lead to the so thrombus can be distorted from the original place, and it can be become a embolus, so it can be stuck in a small capillaries and lead to damage. And the next one is severe cardiac and arrhythmias, because the heart is already very weak, so it will increase the blood circulation, so that will lead to more load on the heart. And next is infected or damaged or irritated skin, because the skin is already having any infection, that will go to blood circulation and it can be spread to the other part of the body. And patient with impaired sensation who cannot report discomfort, it should not be given to the patient with the impaired sensation, because if the current intensity is more, then they will unable to tell the situation, and it can cause many burns or many danger to the patient. So this was about the principles of Russian current. Thank you.